despite those reports out of South Africa describing the symptoms as mild, Omicron was the fastest to be categorized by the World Health Organization as a variant of concern. Let's bring in Dr. Thomas Russo, Chief of Infectious Disease at the University of Buffalo, to talk about what makes this strain such an apparent threat.
Two things. First, the rapid increase in cases in South Africa, where Delta was the dominant variant, suggests that Omicron may be able to outcompete Delta. No other variant has been able to do that. Second, examination of the sequence supports that this particular variant may be more transmissible. And further, perhaps of greater concern, some of the mutations that it possesses suggest that it may be resistant to immunity acquired from prior infection, immunity from vaccination, and protection that individuals could receive with treatment with some of our monoclonal antibodies.
Yeah, and
so taking that together,
I wanted to ask you a little bit about that, because it seems one of the most concerning aspects of the variant are the mutations on the spike protein, more than 30 found so far. So help us understand exactly what that is and how that affects vaccine efficacy.
So the spike protein is the portion of the virus that attaches to our cells and enables infection. And our vaccines are designed to develop antibodies against that spike protein. Variants have arisen during this pandemic that have mutations in the spike protein, some of which render the antibodies developed ineffective. The large number of mutations seen in Omicron, 32, I believe, is in certain areas that is predicted that our vaccines and our monoclonal antibodies may not be as effective. And this is one of the areas of concern that's raised a red flag, and therefore better to be safe than sorry in this particular situation.
Well, and so we hear that information, right? But then we're hearing from health officials, if you don't have the vaccine, get the vaccine. If you have the vaccine, get the booster. What are your thoughts? I mean, knowing that they're not designed right now to combat these mutations found in this variant, should we still be getting them? Should we be waiting for the new booster to come out? How do we move forward here with the vaccines and the boosters?
Well, first, to be clear, we don't really know the degree of protection that's going to be afforded by our vaccines. They've really held up quite well with all the variants described to date. And it's possible with Omicron that our vaccines might not be quite as effective, but it's still highly likely that it will afford a degree of protection to minimize serious disease, keep people out of hospital. And at the end of the day, if we're able to convert infections from Omicron into the common cold, I think we could live with that. So I think that's why there's the emphasis for the unvaccinated to get vaccinated, and those that have been previously vaccinated and eligible for boosters to get the boosters to max that protection and therefore protect against the most serious disease. And that's our real most important goal in this pandemic, is keeping people out of hospital and alive.
Sure, and we are starting to hear from the vaccine manufacturers, some saying that they could be altering the booster shots moving forward. They're waiting on some more research. Is it almost certain at this point that even if you just got a booster shot 6 months from now, we're probably looking at another one?
No, I think it's far from certain. I think we need to learn more about this variant. We also don't know how long the booster shot's going to last. The first two shots, we got about 4 to 6 months out of them. We get a much, much higher level of antibodies with that third shot than we did compared to the first two shots. So I think we're going to get at least a year out of the booster, though that remains to be seen. Whether that's going to be altered by this new variant, we don't know yet. But the good news with these RNA vaccines that are based on codes of the virus, that if we need to go ahead and make version 2.0, we have the ability to do that fairly quickly. So we could adjust if needed, but I think we're still on the learning curve right now to sort out whether we need version 2.0 or not.
Sure. And what's your medical opinion right now on masks? Because even the cities with the strictest mask mandates had started to loosen the restrictions and open up a little more. Now it seems like some places want you to put the mask on again, and things might be, people are being a little more careful now with Omicron. Are they here to stay?
Well, to be clear, masks definitely help. They protect you from getting infected, and if you're infectious, that'll minimize transmission of infection. So masks make sense in areas of the country, of the world, where there's a high community burden of disease. They'll serve to protect you and others. However, as we get on the backside of this pandemic, as cases get down to very low levels, I think we'll be able to get rid of masks Obviously, vaccination is the ultimate mitigation measure, but eventually we're going to enter a sort of an endemic phase. I think that this virus has become seasonal, so we may see some use of masks in the respiratory virus season next year. We'll just have to see.